I think there's two parts to that answer. One is, the concrete, what does it cost to, let's say, replace talc in medicines? But I think the, perhaps larger, more important answer to that question is, what is the cost, the societal cost to this chronic disease epidemic we're suffering, and the toxicity of some of the things in our food and drug supply? So the first part of that answer is that, in fact, it may be, certainly with talc, less expensive to replace talc with modern alternatives like magnesium stearate. So take, for example, 3 of the top 10 prescribed medications: Lipitor, a statin that lowers cholesterol; Synthroid, that's a replacement for those with low thyroid activity; and Nexium, a pill designed to decrease stomach acid for those with reflux, so-called GERD. Those 3 drugs, the branded names, came out decades ago, and they contain talc. They are off patent, and so there are generic alternatives that in fact do not contain talc, because the modern pharmaceutical manufacturing process replace in essentially all drugs, all solid oral dosage formulations replaced talc with magnesium stearate. So each of those 3 drugs I mentioned have generic alternatives that are less expensive and do not contain talc. So in one sense, you can actually replace this toxic substance with a less expensive alternative. I would bet that's also true for our food supply. Although I'm not an expert in food manufacturing, magnesium stearate has the same properties as talc. It's this lubricant, and it's very inexpensive and widely available. So, for example, talc is used in candy and gum. In gum, it's used in the gum base itself. So that's the base of the chewy thing that stays in your mouth even after the taste is gone. Talc is in there. It's also used to make sure that the gum and candy do not stick to the wrapper. So the simple everyday thing is open up a stick of gum. That white powder is likely to be talc. They could just replace that with magnesium stearate. And again, the cost of that is de minimis. So the impact to you and your family, your 5 children and your spouse, would be minimal. There's a certain a transition cost, but it seems to me that that's very, very trivial in the grand scheme of things. Certainly for pharmaceutical manufacturers.